MMT, hip abduction from a flexed position, tensor fascia lata. Assist the patient to the side-lying position with the test leg on top flexed to 45 degrees with the foot resting on the table. Stand behind the patient at the level of the pelvis. Passively move the patient's hip through abduction with hip flexion. You are not assessing the end feel, you are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to abduct the hip from the flexed position as you observe for any substitutions. Stabilize the patient by maintaining the pelvis in neutral alignment with your hand. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include external rotation of the hip to recruit the hip flexors and rotation of the pelvis. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient by maintaining the pelvis in neutral with your hand. Place the hand of your other arm across the lateral thigh, just proximal to the knee, to use a short lever. The force at the lateral knee should be directed downward toward the floor. Apply the force for a 5-second count. Assigning a grade. Grade 5, normal. The hip abducted from the flexed position to the available range of motion, and the patient was able to hold the end position against maximal resistance with no break in the position. Grade 4, good. Hip abducted from the flexed position to the available range of motion, and the patient was able to hold against strong to moderate resistance. Grade 3, fair. The patient is able to move through all the available range of motion in hip abduction from a flexed position, but is unable to tolerate any resistance. If none of these conditions are met, we must reposition the patient into a gravity-eliminated position. Assist the patient into the long-sitting position. Have the patient place the hands on the table behind the body to support the trunk. The body should be leaning backward 45 degrees from vertical. The gravity-eliminated position of the therapist is to stand on the side of the limb being tested. One hand supports and lifts the leg by holding it under the ankle to raise the leg just enough to decrease friction. The hand offers no resistance, nor should it assist the movement. The other hand palpates the tensor fascia lata on the proximal anterolateral thigh where it inserts into the iliotibial band. Monitor the femur for any substitution motions. Ask the patient to attempt to abduct the hip while keeping the hip in 0 degrees of rotation. Grade 2, poor. The patient completes full range of motion in the long sitting position. Grade 1, trace. There is partial range of motion, or you are able to palpate a contraction of the tensor fascia lata on the proximal anterolateral thigh where it inserts into the iliotibial band. Grade 0, no palpable contraction.